Can chronic pain cause or make your sleep apnea worse? Watch to the end to find out. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So there's two different types of sleep apnea that I want to focus on in this video. The first is obstructive sleep apnea, and the second is what's called central sleep apnea. Both are going to be from the same cause, but I'm going to explain what both are first. So obstructive sleep apnea is exactly like it sounds. It's where the muscles around the airway, or possibly the tongue, or both, lose tone when you're asleep at night, and the airway starts to collapse or restrict, or the tongue is going to obstruct the airway, thus leading to you not being able to breathe. That's the most common form. The second form of sleep apnea is a bit more rare, and this is called central sleep apnea, and this is where basically the brain forgets to tell the body to breathe. Okay, so regardless whichever one we're going to be talking about, they're both going to be correlated with the same cause. However, how does this tie into somebody who has chronic pain? Well, the mantra that I want you to say to yourself to understand your chronic pain situation is that a pain problem is a brain problem. I'm going to say it again. A pain problem is a brain problem. Here's why, and here's what we know through the research and what has been shown through different fMRIs, or functional magnetic resonance imaging, so different brain types of imaging out there, has shown that those that struggle with chronic pain actually changes the structure and function of the brain. You start to lose these higher brain centers, and now you start to function from a more lower or base type of brain function, which is not good, especially for existing in a complex lifestyle and complex time that we live in. Now, a pain problem is a brain problem. We understand this because if you think about somebody who has what's called phantom limb pain, or they've lost an arm or a foot or something like that, they no longer have this tissue connected to their body, yet they're still experiencing pain as if that tissue or that hand or foot or limb is still there. So how can this be? The tissue is not damaged, it's not injured, because it's not even there on the body anymore. So what's going on? Well, the brain has this perception of what's going on in the body at all times. That's part of the brain's job. It has to constantly know what's happening in its internal environment, meaning inside the body, as well as its external environment, everything outside of the body. So the brain has to always know what is going on. And when that brain, first of all, starts to lose that proper connection down into the body, meaning the body is no longer sending all of the proper information, kind of like when you have a map that starts to get a bit fuzzy, you can't see all the different areas of what's going on, or kind of like if you're outside in the dark, you maybe know what your backyard looks like, but when you turn the lights off, or if it's nighttime, you can't see the entire backyard. Maybe your flashlight doesn't light it up all the way. Same thing that happens in the body. You don't have all the proper connection and communication to what's going on. And when this starts to happen, you start to increase what's called the stress response, or you get what's called stressed brain syndrome. So our nervous system functions in two different states. We have our fight or flight state, and we have our resting, relaxation, and healing state. So our brain is always perceiving this information around us, and it does that through our cranial nerves in our head. So our cranial nerves are all up in the brain. They come directly off of the brain, and they're responsible for all of our life experiences. Things like hearing, sight, taste, smell, as well as breathing and swallowing. A particular one that we're going to focus on is what's called the vagus nerve. So the vagus nerve is the primary nerve for swallowing, for the muscles in the back of the throat, as well as it's one of the main nerves for that parasympathetic system. Now our brain in that autonomic state, that parasympathetic and sympathetic, that healing relaxation mode and stress fight or flight mode, is always in balance. It's like a teeter-totter. So when one goes up, the other one goes down. So when you get into a chronic pain state, what happens is you start to increase more of that fight or flight state. And over time, when you're in that chronic pain state, like I mentioned, it starts to rewire the brain. So when it starts to rewire the brain, it starts to increase these areas that cause this stress response. So specifically the amygdala and some of the other lower fight or flight centers in the brain, those start to grow. And what happens is these other centers that are responsible for keeping the lid on those things, kind of like a brake pedal, meaning our frontal lobes here, those start to shrink. So now we're starting to be more and more prone to be in a more sympathetic or fight or flight dominant state, thus leading to decreases in levels of our ability to, or our thresholds for pain, which means you're going to feel pain more easily, you're going to feel pain longer. And when you're in a fight or flight state, let me just ask you the question, do you think you're going to sleep better or worse? You're probably going to sleep worse, right? Because if you're in a state of survival, if you're thinking there's a fire alarm going off, you need to escape a burning building, you're not going to sleep very well, right? And what starts to happen is it starts to shut off that vagus nerve, the tone and muscles here in the back of the throat, which is going to cause some of that obstructive sleep apnea because you're losing tone in the muscles here because your brain's stuck in this chronic stressed out state. Now with the more central sleep apnea, this can be caused from a number of different things, potentially brainstem dysregulation back here, since that's where your major breathing centers are going to be located, but you're also going to have issues in terms of potential brain damage or injury, or even structural problems too if you have changes in the architecture or the actual soft tissues around the neck. That can also cause problems with the brain's communication down to the rest of the body. So in a nutshell, here's what's going on. You have an increase in that fight or flight response due to this chronic pain signal happening over and over and over again. The brain starts to change, thus it's more prone to being in a chronic stressed out state. When that happens, you start to get a decrease in the function of that vagus nerve down to the soft tissues around the throat, thus leading to that lower tone when your brain goes to sleep at night and certain brain centers start to shut off. That leads to lower tone in the neck and the muscles around the neck supporting the airway and possibly the tongue. That is all going to lead to that obstructive sleep apnea, brain damage, changes in architecture and or tension and tone around the brainstem area can lead to that change in central sleep apnea, thus the brain forgetting to breathe down into the body. So what you need to do is you need to start to exercise, or you need to increase that parasympathetic function in order to change how well and how balanced the brain is. So on that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.